Welcome to Health Break by UPMC Health Plan, your quick guide to health, wellness, and how to make the most of your health insurance plan. I'm your host, Dr. Camille Clark-Smith. This is your Health Break. In this episode, Dr. Joanna Vidal-Fallon and Dr. Robert Rutkowski take a health break to talk about RSV. They will discuss how getting vaccinated against the respiratory virus can help protect your family and you from getting sick from it. Dr. Bob and Dr. Joanna, thank you so much for taking a health break with us.
Thank you so much.
Thank you for having us.
As two pediatricians, we're really happy that you're able to talk to us about this important topic. So, Dr. Bob, my first question is for you. We're hearing more about RSV these days. Can you tell us what is it, and is it a new disease?
Sure. RSV stands for respiratory syncytial virus. That sounds scary, but it's actually a virus that most usually causes a cold with very mild symptoms. It can take about 2 weeks to get better from, but it can be more severe in newborns, infants, and older adults. RSV is not new. It was discovered in the 1950s. We're hearing more about it since we can prevent it, especially in those most vulnerable age groups.
So, Dr. Joanna, could you tell us more about the symptoms of RSV and how they develop?
That's a great question. The symptoms of RSV are multiple. So, for example, you could see a young child with a lot of nasal congestion, a runny nose, coughing, sometimes wheezing, sneezing, fever, decreased appetite. And this is definitely very concerning for little ones because of the congestion that RSV can cause in little children. It makes it difficult for them to feed, especially if you're breastfed or drinking from a bottle. As a result, many children in this age group may present with dehydration. Another symptom that we often see with RSV is called apnea. Apnea is when a child pauses breathing for more than 10 seconds. Unfortunately, during the RSV season, many babies require hospitalizations due to dehydration or respiratory distress. RSV can be particularly dangerous to newborns, especially those that are premature, have chronic lung disease, or have a weakened immune system. If you are exposed to the virus, infected people usually develop symptoms in 4 to 6 days, and unfortunately can infect others 1 to 2 days before starting to show signs of illness. I think it's also important to let the public know that because RSV is a viral infection, treatment is primarily symptomatic. Antibiotics do not work against this virus or any other viruses. Fortunately, we now have a new vaccine that is available to help protect babies against RSV.
It sounds like the RSV immunization and vaccine has really been a game changer. Dr. Bob, could you explain more about who is eligible and when?
This is a fairly complicated answer, but the easy answer to this really is to talk to your primary care person for yourself or your child. They're the expert in your care, and they're actually who you want to consult before getting the vaccine or the immunization. I'll try to break it down into 3 easy groups to remember. The first are infants younger than 8 months who are entering their first RSV season. And RSV season is usually somewhere between October and March to April. The second group are infants 8 to 19 months, but these are special children who have risk factors for severe illness, babies who are premature, have chronic lung disease, immune problems, cystic fibrosis, or are in high-risk populations like American Indians or Alaskan Natives. And the third group is those adults who are at higher risk, those 60 and older after consulting with their primary care person, or pregnant people who are 32 to 36 weeks pregnant during the months of September to January. If they get it, then their baby doesn't need to get their own immunization. I call that taking one for the team.
So, Dr. Bob, you mentioned the RSV season, but Dr. Joanna, can you tell us more about that?
Yeah, of course. In most regions in the United States, the RSV season usually begins in the fall. It peaks in the winter and can continue into the early spring months. But the season of this virus can vary from place to place and from year to year. That is why I ask that you talk to your doctor or healthcare provider if you have any questions about this vaccine and when it should be given.
My last question is for both you and Dr. Bob. As pediatricians, what is your perspective on the RSV vaccine, along with other vaccines like the COVID-19 or flu?
Yeah, as a pediatrician, I really strongly advocate in favor of immunizations, including RSV, COVID-19, and influenza immunizations and vaccinations. Unfortunately, I have witnessed numerous newborns and infants requiring hospitalization due to these viruses. It is truly heartbreaking to see so many little ones suffering. If we can prevent unnecessary illnesses and hospitalization through vaccination, why not? We also need to keep in mind that when little ones are sick, parents or caregivers are unable to work, and it has an impact on the entire family.
Yeah, let me just add that vaccines are safe, or we really wouldn't recommend them, that they save lives, and we're fortunate to have them.
Vaccine saves lives.
Yeah, and I want to add also that not only is Dr. Bob or myself pediatricians in clinical practice, but we also are parents, and we have children and young adults in our home, and they're fully vaccinated. So we have provided immunizations to our children and our family and continue to recommend them, not only to our families, but to our friends too.
Yeah, we trust science.
Lead them by examples. I love it. Well, thank you so much, Dr. Bob and Dr. Joanna, for joining us today.
Thank you for
Thank
having
you.
us.
Appreciate it.
If you have questions about vaccinations for yourself or your family, reach out to your healthcare provider. When searching online for information, exercise caution and rely on reputable websites such as the CDC, the Centers for Disease Control and Prevention website. Find show notes and more information at upmchealthplan.com/podcast. Join us as we continue exploring health, wellness, and how to make the most of your health insurance plan in the next episode of Health Break. This podcast is for informational and educational purposes. It is not medical care or advice. Individuals in need of medical care should consult their care provider. Views and opinions expressed by the host and guests are solely their own and do not necessarily reflect those of UPMC Health Plan and its employees.